So something very important that I recommend to every single female that I treat is the use of a lubrication, the use of a lube. Oftentimes we've been taught, I think, or society has taught us that the level of lubrication that we naturally have is indicative of the level of arousal. But that's been disproven. You can be very aroused and not so lubricated, or you can be very lubricated and maybe not so aroused. There are also many reasons why your lubrication might be lower. For example, antidepressants, different types of other medications like antihistamines, breastfeeding, pregnancy. So I like to recommend using a lubrication to all patients. But now, some lubrication is better to be used while on a fertility journey. So if you are actively trying to conceive, we recommend different lubrications, but always use lube. Just always apply it. It takes the pressure off. It allows for less friction, less pain, and definitely ease in penetration. So if you are trying to conceive, there are a few lubrications that are recommended. Firstly, there's a lubrication called Pre-Seed. It is quite pricey and maybe not necessary, but that is known to be good for conception. According to the doctors at Vitalab, Dr. Deanna Gudozi always recommends a water-based lubrication. So you can generally find them just at discount on the shelf. They're really not too expensive, as long as it says water-based. And other fertility gynaes have also recommended the use of a simple oil, like a coconut oil. Coconut oil or baby oil might also be good to use, but according to the doctors at Vitalab, we like to stick to a water-based lubrication. Problem with the water-based lubrication is that it can dry out. So we like to reapply often. So if you feel like it's drying out, just keep reapplying. So you can reapply to the vaginal area, you can apply internally, or your partner can apply it to his penis, which will allow for easy penetration and a lot less friction.